Hi guys, this is Jason Williams, DO. This is the Williams Family Medicine channel, helping you to live your best life. Today I wanted to visit with you about celiac disease. Celiac disease goes by a couple of other names: celiac sprue, non-tropical sprue, and gluten-sensitive enteropathy. Amazingly, celiac affects about 1 in 100 people. Unfortunately, up to 80% of people that have this condition are unaware. If you have a first-degree relative that has been diagnosed with this condition, then you have a 1 in 10 chance of developing this condition in your lifetime. Like many genetic conditions, this condition has heritability as well as environmental factors that influence it. If you have the correct genetics, this is determined by HLA or human leukocyte antigen types, as well as the correct environment such as stress, toxins, ingestion of gluten, then you can develop this condition. Gluten is a protein that is found in wheat, barley, rye, and oats. If you're predisposed to this condition and you ingest gluten, then your body mounts an immune response. The T cells, the T cell lymphocytes in your body, attack the enterocytes. Enterocytes are the cells that line your intestines. The enterocyte cells become damaged, and now you cannot absorb nutrients as you should. I'm going to read from a list of common symptoms that you might have if you're a child and you develop gluten-sensitive enteropathy or celiac disease. They are bloating, pain, diarrhea, constipation, foul-smelling stools, nausea and vomiting, weight loss, delayed onset puberty, failure to thrive, fatigue, headaches, irritability, anxiety, depression, ADHD, learning disabilities, seizures, lack of muscle coordination. In adults, symptoms might include abdominal pain, bloating, gas, nausea, vomiting, constipation, diarrhea, depression, cognitive impairment, anxiety, fatigue, headaches, skin rash, joint pains, menstrual irregularity, mouth ulcers, weight loss, poor bone mineralization, and neuropathy. A lot of overlap between children and adults. If you have celiac disease, then your risk of coronary artery disease is double the population of people that do not have celiac disease. Your risk of small bowel cancer is 4 times that of someone who does not have celiac disease. I'm going to read from a list of other associated disorders that are found in those that have celiac disease. These include anemia, thyroid disease, lymphocytic colitis, diabetes mellitus type 1, peripheral neuropathy, ataxia, multiple sclerosis, osteoporosis, infertility, miscarriage, epilepsy, migraines, heart disease, gallbladder dysfunction, lactose intolerance, liver failure, malnutrition, attention deficit hyperactivity, headaches, seizures, dementia, pancreatic insufficiency, vitamin and mineral deficiencies, and intestinal cancer. Quite a list of many disorders that we see often. There are a couple of ways you can diagnose celiac disease. One is with blood work. You can draw levels of tissue transglutaminase and endomycel antibodies. These are both immunoglobulin A antibodies, and you must be on a gluten diet in order to have a positive with these tests. Since these tests require IgA antibody mounting response, if you happen to have an IgA deficiency syndrome, then you must do a test called a deaminated gliadin peptide test. Other ways that you can diagnose this include intestinal biopsy at endoscopy and even skin biopsy if you happen to have the characteristic skin rash called dermatitis herpetiformis. Other lab work that is often tested in those with celiac disease include a complete blood count, iron studies, thyroid function, and vitamin and minerals. The treatment for celiac disease is a gluten-free diet. Due to the vitamin and mineral deficiencies that occur, it is also common to supplement to correct these deficiencies. It is not uncommon for patients to see a nutritionist. Because T lymphocytes are at play in mounting an immune response in your body, much research right now is centered around modifying the CD8 T cells that seem to be implicated in this disorder. In those people that have celiac disease that go on a gluten-free diet but still have symptoms, sometimes they have other forms of colitis or inflammatory bowel disease that have developed. There may also be occasions of small intestinal bacterial overgrowth or pancreatic insufficiency that develop. The symptoms that you might experience with these conditions might mimic that seen in celiac disease. As I spoke earlier, celiac disease is very prevalent in the population. The incidence of celiac disease is increasing. Another condition that shares many similarities with celiac disease is diabetes mellitus type 1. This has also increased in incidence recently. According to a 2008 study I read, diabetes mellitus type 1 and celiac disease share similar HLA heritability. Patients that have both celiac disease and type 1 diabetes are getting a double whammy. It seems that incidence of nephropathy and retinopathy is increased markedly in those that have both conditions together. This is a microvascular type of complication. It makes sense if you have celiac disease and you poorly absorb B vitamins. Low B vitamin levels result in elevated homocysteine levels. Elevated homocysteine levels have been associated with increased cardiovascular risk. Earlier I spoke about environmental situations that can trigger celiac disease. Enterovirus and rotavirus viral infections are a couple of those that have been noted in articles that I read. Both of these are fairly common infections. Both can trigger increased incidence of diabetes mellitus type 1 and celiac disease, per a study that I read in 2006. If you think about celiac disease and think about eliminating gluten, then you also realize that a lot of products that contain gluten have carbohydrate in them. One would think if you eliminate gluten and you happen to have diabetes mellitus type 1, then you're going to improve glycemic control or blood sugar control. The journal article that I read in 2020 showed exactly that. They showed decreased hypoglycemic episodes and a reduced hemoglobin A1C in patients that had both celiac disease and diabetes mellitus type 1 that went on a gluten-free diet. As we mentioned earlier, celiac disease results in decreased absorption of vitamins, and one of those is vitamin D. Vitamin D deficiency is rampant. It is estimated that at least 2/3 of the US population is vitamin D deficient. Vitamin D deficiency affects sex hormone function, immune system function, and even results in mental health disorders in some. Of course, vitamin D deficiency is also a player in osteoporosis. As I mentioned at the beginning of this video, as many as 80% of people have this condition but are unaware. This makes you wonder if some of these cases of vitamin D deficiency are actually cases of celiac disease that are undiagnosed. I spoke about lymphocytes being responsible for causing the immunological reaction that results in celiac disease. Mast cells also have been shown to be part of this reaction and seem to react to the protein found in gluten. There are two very similar conditions that seem to be related. One is mast cell activation syndrome, and I have produced a video that outlines this condition. Another is hereditary alpha tryptosemia. Many different symptoms occur with these syndromes. Some of them involve skin, such as flushing, itching, and hives, but they also cause gastrointestinal problems such as abdominal pain, diarrhea, and bloating. In a study from 2019 that I read, they're looking carefully at mast cell function and celiac disease and have noted quite a difference in mast cell activation in those patients with celiac disease. At this time, more research is focused in this area. To summarize, celiac disease is a condition that you inherit, but yet is triggered by environmental influence. And of course, if you eat gluten-containing products, such as wheat, rye, barley, oats, then you are triggering an immune reaction that causes the symptoms. There's a spectrum of how severe you may be affected by celiac disease. Many people that have celiac disease don't even know they have it. I suspect that many people are being diagnosed with other conditions and being treated for symptoms with medications without knowledge of the root cause. If you have strange, unexplained symptoms, it might be worthwhile to dig a little deeper. I'm always interested in root cause medicine. I have noticed a pattern of a significant change in recommendations regarding diet, carbohydrate intake, which would include wheats, breads, pastas, cereals. The incidence of this condition has been increasing over the last few decades, which makes sense based on these recommendations, which include eating much more of these type of products. If you are my patient, I hope you found this information useful. If you're not my patient, please see your doctor for diagnosis and treatment. This is Jason Williams, DO. This is the Williams Family Medicine channel, helping you to live your best life. Take care.